In 2020, something didn't add up. When fear replaced common sense and critical thinking, and protocols stopped matching what we were seeing, a lot of us started asking questions. And once you start digging, once you start researching, you can't unsee it. Welcome to Nurses Out Loud. I'm Jodi O'Malley, ER nurse and nursing ethics educator. And this is where we talk truth, patient rights, and real-world healthcare so you can make informed decisions and advocate with confidence. If you've been looking for your people, here we are. If this resonates, if you find yourself nodding along, please like, follow, and share this show with at least one person who needs it. And if this episode offers continuing education credit, check the show notes for learning objectives, disclosures, and exactly how to earn your certificate. Today's episode of Nurses Out Loud is sponsored by West Cocoa Pharmacy and Compounding in Cocoa, Florida. They partner with licensed providers to compound ivermectin and other repurposed drugs, plus integrative protocols for people working with their oncology team, along with low-dose naltrexone, methylene blue, bioidentical hormone replacement, and men's health formulas. And my favorite part is you can speak to Nurse Donna for free. Learn more at cocopharmacy.com, COCOA pharmacy.com. This is educational only, not medical advice. For 5 years, we've been told to be quiet about what happened in hospitals, quiet about what happened with the protocols in the hospitals, quiet about the loved ones we dropped off at the doors and never saw again, quiet about the husbands and the wives, mothers, families, fathers who walked in alive and never walked back out, quiet about the nurses and doctors who tried to speak up and lost their careers for it. For 5 years, we have grieved alone. We've been gaslit. We have been told to move on, to accept it, to stop asking questions, that justice and accountability will never be served. Well, today that ends. This is the moment we have all been waiting for. Senator Ron Johnson, chair of the Senate Committee on Homeland Security and Governmental Affairs, has agreed to open the congressional record. Every statement submitted will be entered into the official record of the United States Senate. Everyone, whether or not the person who wrote it ever sets foot in Washington. But there is a threshold. He needs 200 statements to proceed. And the only person standing between us and that hearing is the widow who agreed to collect them. Her name is Leslie Thompson Batts. She lost her husband, Paul, to these same hospital protocols in October of 2021, and she is here with me tonight. Leslie, thank you for being here.
Thank you so much for having me, Jodi. This is an amazing opportunity, and I really appreciate it.
You are welcome, girl. Your story, and sadly, I believe that there are tens of thousands, maybe even hundreds of thousands of people that have a very similar story. And that is why the hospital protocols, a lot of people call it the hospital death protocols. People are calling it murder. I try to stay away from that language just because I want this to get out to as many people as possible. But what cannot be denied is you talk to anybody. I don't even care if I talk to somebody at a baseball game and they find out that I'm a nurse and I bring up the word COVID. I will hear your story. Guys, we have a lot of the similar stories. And there was groups that were created for the widows, husbands, wives, right? We have to remember that it wasn't just the husband that was taken away or the wife that was taken away. It was the grandmother, the cousin, the best friend. So lives have been changed for generations, and it all happened because the standard of care were changed overnight. And so, Leslie, I want you to just tell our listeners from the jump what happened. Why is Senator Johnson doing this, and what is he doing? And then we'll get into what we need from you guys to make this actually happen.
Well, based on the conversations that have been had with Senator Johnson, it appears, he's been wanting to do this for some time. He's acknowledged it. He's acknowledged it in previous hearings that he wanted to do these, these COVID protocol hearings. I don't know specifically why the time is now, other than he found a couple of people that were willing to do the work and do the legwork. He's been extremely busy doing the vaccine injury and exposing the COVID vaccine hearings. Yeah. So they're overwhelmed. And he said, look, I can't take this on myself right now. I don't have the time. I don't have the resources and the manpower in my office to do this. If you are willing to get me the testimonies, credible witnesses who are willing to come and testify, I will fight for these hearings. We will get this done. But I have to be able to overwhelm them with the evidence that this needs to be addressed. And that's our goal, is to make this undeniable so that time cannot pass and it be forgotten, so that these stories are memorialized and, documented in perpetuity, so that it can never be denied that it occurred. And, like I said, it's humbling to be able to participate in this. And we're going to do everything we can to accomplish that goal and make this happen for everyone.
Yeah. So to the families who dropped their loved ones off at the hospital doors and never saw them again, well, I'm talking to you. You watched them walk in alive. You waited for updates that never came or came too late. You were locked out, kept out, told no visitors while decisions were being made about your loved one without you in the room, without you on the phone. And you begged to be heard. You demanded video calls. You were told that they were doing fine right up until the moment that they weren't. This is a story that belongs in the record. What happened to your loved one, I guarantee you, happened to thousands of people. And the Senate needs to hear from you. To the nurses and doctors, your testimony tells the bigger story. You cared for COVID patients for months, over a year before any mandate existed. You had the right to make your own medical decision about an experimental product, whether you believed you needed it or you didn't need it. You had concerns on bodily autonomy and informed consent, and there was a reason why you consciously objected and why over 100,000 nurses left the profession. We need to hear from you. What did you see happen to patients? What did you see happen to the standards of care? What did you see happen to the evidence-based practice? You were told that if you didn't take this experimental injection, that you were going to lose your career. And many of you guys stayed silent because of it. We want to hear from you. We want to hear from you as well that walked away from the profession, because that's not consent. That's not ethics. And you wanted to walk away before you violated the principles that our profession was built on. So Leslie, again, I just want to reiterate, because a lot of people are going to wonder why there is not a Senate email here, like a .gov email. Please be explicit in explaining why we are giving out your email and what you're going to do with it after you receive these submissions.
Well, and kind of as I explained before, Senator Johnson has made it very clear that he just does not have the ability to take this task on right now. It would come at some point, but I think right now the time is ripe. People are starting to recognize and acknowledge that we weren't always told the truth about what was going on with a lot of things during COVID. It's no longer so censored that you're not hearing the stories at baseball games and on social media. One post goes out and you will see hundreds of people saying, it happened to my loved one. It happened to my mother. It happened to my father. It happened to my husband or my wife. It happened to my children. This wasn't a one-off, a unfortunate mistake in a lot of cases. It was a established pattern that we have seen across every state, and almost every hospital in every state. And not only, and I appreciate you putting out the plea and saying, we want your testimonies. We don't just want your testimonies as medical professionals. We desperately need your testimonies. The loved ones have spent the last 5 years desperately trying to put the pieces together of a picture that we weren't there to witness, through medical records, through call logs, through text messages, through bits and pieces of information that would filter out of the hospital that we were denied access to. Many of us had no idea what had occurred prior to receiving medical records. Before I got my husband's medical records, I really thought he died from COVID. I really believed it because I didn't have any reason not to. I got his medical records for one reason and one reason only. I wanted to find any signed consent form in his medical record. That's it. That's the only reason I got his records. They told me he had given consent. I didn't believe it. I said, I have to see that for myself, for my own peace of mind. And not a single signed form, not one. So we are, like I said, we are left trying to piece together a picture that we don't even know what it should look like in a lot of cases. Filtering through data we don't have, in a lot of cases, don't have the ability to understand, especially in context, especially in a critical care context. You know, how oxygen deprivation affects, physiological systems and so on and so forth. So having those witness testimonies from the inside is so incredibly crucial to finish putting together the picture that we're missing so much of.
Yeah. So here are the guidelines that we kind of need you to follow. First of all, who can submit this story? Anyone. Anyone. We want to hear all of your stories, okay? The families, your loved one. Was it your cousin that passed away? Was it are you a nurse? Anybody's story through the lens of hospital protocols and COVID, okay? It has to be your story only, no speculations, facts that you can support and speak to. We want to avoid defamation. Don't send your supporting documents yet. They will be asked of you later, and just be ready to answer questions if contacted. The story has to be in 600 words max. Let me say that again. 600 words max, because I understand every one of us have an emotional story to tell, but you're going to write your story the way you want to. I don't care if it's 10,000 pages, but you're going to put it into an AI system and say all of the things that I just told you. I'm going to put this in the show notes. I'm going to put it in a Substack article, all of the criteria that he's asking for. And it has to be in a PDF file and emailed to Leslie Thompson 0831@gmail.com. And in the subject line, you'll say for the record only or testify if you want to be considered to testify. Obviously, there's many of us that have horrific stories, okay? But you want to talk about that a little bit, because we don't have any control over that. It doesn't matter. I mean, that's where I kind of tell people, put it in God's hands and let the chips fall where they may on that one.
So what we're looking for in these testimonies, it has to be very succinct. It has to be your personal experience only. It needs to be your eyewitness testimony, as if you were standing in front of the committee hearing and speaking to them directly. We have been told very clearly that it needs to be about 600 words, because when you make an opening statement to Congress, you have a 5-minute time limit. You may be asked additional questions, but you only get that first 5 minutes. And there is a time limit on that because they have a time limit on the hearing. So he wants to read your testimonies as if you were sitting there telling him your story. So he can select select the individuals he wants to choose to testify. So that's why we have this criteria for the 600 words or less. Do not, please, I understand many people have lots of evidence to support their stories. We are not prepared for a chain of custody to make sure that that submission of evidence cannot be accused of being altered or edited or, adulterated in any fashion. We're not capable of doing that. And to be perfectly honest, I don't want to put myself in the position where I need to be responsible for chain of custody or the even slightest appearance that there could be any inappropriate, anything inappropriate happening.
And you're not going to sell their emails.
No.
Right? Okay. Just throw that out there.
No. And you had asked earlier about why it's my personal email. As I said, it was just something that we chose to kind of take on this task so that it doesn't take another 2 or 3 years. If we can put this together in a pretty little package for him where all he has to do is pick it up and run with it and be ready to roll and get things underway, it will happen much faster. And
Yeah.
right now, again, right now is the time. Right now, people are willing to hear it. Right now, people are willing to talk about it. For many years, it wasn't something people even wanted to talk about. So,
Yeah. Yeah.
going back to the criteria, it cannot be anything that would constitute defamation. You mentioned the M word earlier, and we try to keep that because we get censored everywhere.
Yeah.
It gets pulled
Yeah.
from everywhere when that word comes out. So, not using inflammatory language that speculates my statement. I stuck to the facts. Do I believe? I actually have a medical expert's written statement to the Attorney General that says he believes, based on his review, that it was premeditated murder. But I
Hmm.
won't say that because I cannot identify that that occurred in the medical
Hmm.
records and swear to that testimony. So those are the kind of things that we need to be very, very careful of as far
Hmm.
as slander, defamation, libel, because we don't want to put Senate in. And it's hearsay. If it does go to an investigation and these testimonies are on the record, it can't be used as hearsay.
And so let me put this into context a little bit too for people, because some people might hear hospital murder, that happened. Well, the people that lost their loved ones, they look at the medical record and they see a sequence of events. It was actually like ventilator, remdesivir, death, rinse, repeat. Okay. And not everybody that was on a ventilator, not everybody that had remdesivir, not everybody that was given Ativan, morphine, sedations passed away, but there's a lot of people that did. And so the purpose of this also, guys, is to look into how did this happen? Why did this happen? Why did we as healthcare professionals deviate so far away from the standards of care when people weren't dropping dead on the streets? We didn't see our public health agencies walking around like the movie Outbreak, guys. We had nurses and doctors taking care of patients, and we left work in our scrubs and we went to Walmart, okay? We went to wherever we had to go. This was not what they made it out to be. The United States of America has the absolute worst outcomes of COVID. And if you look into why, you will see because it was of the hospital protocols. Okay. It was the hospital protocols. It was the isolation, the removal of the advocate from the bedside, the doctor's not having to go into the room and getting reports from the nurse and then charting report received from nurse due to lessening COVID exposure. Pharmacy not going in and doing MedRec. The nurse did that. But the nurse also put them on remdesivir, put them on high flow. People weren't eating. People weren't engaged with family. They lost the will to live. They weren't getting antibiotics. They weren't getting steroids. Okay. There's so much to it. And I'm not saying everyone, but this was my experience. Okay. I list a patient that had alcohol withdrawal. He had alcohol withdrawal. He had a positive COVID test. And then the doctors would not treat his rising white blood count. They were not treating it. The nurse had said, hey, he spiked a fever. Should we get an antibiotic on board? No, he's alcohol withdrawal and he's COVID. It's not indicated. I come on shift and I say, Doc, he's got a fever. His white blood count is up. Yeah, it's not indicated for COVID. You know what I did? I obtained a sputum sample. I obtained that sputum sample. It came back with 3 or 4 different types of community-acquired pneumonia, bacterial pneumonia. That patient died. I did get an antibiotic on board, but it was too late at that point. That patient died. That patient is in my whistleblower lawsuit. I have evidence. Everything is there. This is what we need from you guys. We need to hear your story. And listen, so many of us were complicit because we were told by the media, you're going to kill grandma if you don't do this. You're a horrible human being if you don't stay home, go on the beach and you want to be out on the beach and you want your children out in sunlight. No, you're horrible. Stay home. Right? I could go off on all of this. You guys know, because I am in the medical field. I'm back in the hospital. I've been back for the last 3 years. And anytime I give people an opening to talk about COVID, the stories that just come forward. People know what happened now. We know. And this is our opportunity. Finally, we have a congressman or senator that is willing to open the floodgates on this. One more thing I'll say, and then Leslie, I want you to tell your story. I had in my heart a couple of weeks ago, the words that came over me. This is how God speaks to me. Okay. He speaks and it resonates in my spirit and I just can't let it go. He said, there has to be a massive public outcry. And I didn't actually know what he meant by that. What does that look like? And then a couple of days ago, I see Senator Johnson is going to open this up if we can get 200 statements. And people ask me, do you think that there's going to be COVID accountability and justice? And I said, not unless there's a massive public outcry. And there you go. And this is how God works. This is how the Holy Spirit moves. If you need help, if you want to send me your 10,000 word story, I'll copy and then paste that and put it into AI for you and cut it down to 600 words. But you can do it too. But what I'm saying is we need to get this done. We absolutely need to get this done.
It's time.
It's beyond. I can't even believe that it's been this long. There's so much, right? There's so much. Leslie, in the next couple minutes, I want to hear about your husband, Paul, and why you're so passionate about keeping this going, because so many people have told you to move on. Get over it. I'm sorry too, but Jodi, are you going to continue to talk about COVID? Yes. Yes, I am. Yes, I am. For all those people that died. All the nurses that walked away. We lost over 100,000 nurses because they didn't want to do this. It's a story for another day. I'm going to do a podcast on that, but.
If you are a nurse that is fed up with the sick care model, I have a solution for you. My name is Melissa Schreibvatter, and I am the owner and founder of the Functional Nurse Academy. FNA is the most comprehensive functional medicine training program on the market, specifically tailored to nurses. It is self-paced and equips LPNs, RNs, and nurse practitioners to practice functional medicine, address the root causes of dysfunction, and start their independent functional medicine practices. At FNA, you will learn how to order labs, functional health reports, create customized wellness plans, package and price your services, and even how to market your brand effectively. Graduates earn 90 nursing CEUs, and then they qualify for multiple board certification titles. They also will have access to our exclusive tools, such as our Functional Nurse Toolkit, our social media and marketing kit. And I don't want to just train you and send you on your way. So you also will get access to me each month via the Functional Nurse Academy monthly mentorship program, where you will be able to attend a live class with me each month. So say goodbye to sick care and start your dream career as a functional medicine nurse. Enroll today at functionalnurseacademy.com.
I want to hear about Paul. Who was he?
My best friend. He was the center of our family. He was your classic cowboy. Not a whole lot of words, but the words he used resonated with everyone, right?
Yeah. How old was he?
45. He was my son's best friend, his fishing coach or his fishing buddy, his hunting partner, football coach, baseball coach, just everything. Everything. He was what you picture. And, the old leave it to Beaver dad there for his kids and just the provider, very much the man of the house. And I admired that about him. He still opened doors for me 10 years later. if I was getting out of the car, he came around and opened the door. He was an amazing man. He was absolutely amazing. He worked hard. He enjoyed life. We had a very simple life, you know. We had a little farm, chickens, goats, horses, cows, you know, and just a good man. Really, really good man. Strong, healthy,
Healthy. He had no
built
comorbidities.
built like a ton of bricks, you know, solid guy. But at heart, he would literally do anything for anyone. He was a protector, you know, very much a protector. He didn't want to see anyone falter if he could be there to support them. Just an amazing man. And it was so shocking to me. I mean, the series of events that unfolded were to get to the hospital, to get to the COVID ICU unit, were just absolutely absurd to me. You know, we thought we were knowledgeable, we thought we were aware, but we lived in rural Oklahoma, the reddest of the red states. You know, we thought, oh, this stuff doesn't happen here. You know, and I'm not trying to make it political. Don't
Yeah.
get me wrong. But this became a very partisan type of thing. You know, we heard about people being not targeted, but treated differently for being unvaccinated.
Mm-hmm.
And so we said, okay, well, we chose not to get vaccinated. But most of Oklahoma, we assumed, had chosen not to get vaccinated. Well, what we found out is by the time he made it to the hospital, the mandates had already been in place, and the people that wouldn't take the mandates had already left. They were gone. And
You
I
mean
will tell you,
left the profession?
yeah. And I say this, I give this example to highlight exactly what I mean. By being treated differently for being vaccinated. Not to be defaming because it's all factual, but the doctor that treated my husband was on social media 2 months prior to my husband being admitted to the hospital saying, if you come into my ICU, you're in big trouble because if I have to put you on a ventilator, you're probably not going to survive. We haven't had anybody survive in months, right? If you're not vaccinated. On one hand, that can sound like, you know, a public service announcement, please, you know, motivating people to get vaccinated. On the other hand, it could also sound like a threat. But the first phone call after my husband was admitted from that doctor, he said, Miss Batson? I said, yes. He said, well, I hope you're vaccinated because your husband's getting ready to go on a ventilator for a month and he's going to be, you know, in rehab for a year if he survives, and you need to be alive to take care of him, or somebody needs to be vaccinated so they're alive to take care of them. I said, who is this? He said, well, I'm the doctor taking care of your husband. I said, not with that attitude. I just talked to him. Why are you talking about a ventilator? When he got out of the car at the hospital, do not let me put them on a vent, or do not let them put me on a vent. I'm getting text messages from him. They won't stop asking me about intubation, and I'm starting to lose my cool. And this is why the very first thing that I did after he passed was for my peace of mind, because the doctor, the day they ventilated him, called me and said, well, he's given consent and I want your consent. And I said, if he's given consent, you don't need my consent. There'll be a signed consent form on the thing. I said, and I haven't talked to my husband in 24 hours because we didn't know this, but he had been being sedated. Nobody told me. I was being told he was just refusing to speak to me. He was on 0.7 micrograms per kilogram an hour of
Precedex.
for the last 33 hours.
So
And I hadn't spoken to him. I'd had no communication with him. I couldn't get him on his text messages. I'm calling the nurses. The nurses at the station saying, oh, he's doing fine. He's watching TV. He just doesn't want to speak to you. Found out in his medical records later, the real story. But I said, well, I'm sorry. I can't take your word for it. I haven't spoken to my husband. I want to speak to him now. So I called a video call on his phone, and somebody answered. I don't believe my husband actually picked up the phone because it was too far away. I mean, you can see how far I am from the camera, and you can see my hands, right?
Mm-hmm.
It was too far away for him to be holding the camera on the phone, and I couldn't see his hands. And he had a BiPAP mask on, so I couldn't understand what he was saying. The video lasted 31 seconds. He clearly was not in respiratory arrest. I can tell you that. And at 31 seconds, the call was disconnected. Immediately, the doctor calls back and says, do I have your consent to intubate? I said, no. He didn't tell me that was what he wanted. You don't. If he's telling you he's giving you consent, you don't legally need my consent. I don't understand.
Right.
I can see him. He's clearly sitting up. He looked a little disoriented. but he looked more agitated, like trying to communicate something. And I said, so clearly he's capable of signing a consent form. Why do you need my consent? I gave my final refusal. And 2 minutes after I hung up the phone with that doctor, they administered 40 milligrams of etomidate and 100 milligrams of rocuronium.
Sucks. Rock. To intubate him.
For 6 minutes, he was in respiratory arrest before they were intubated. Now, my understanding of intubation, and I'm not a medical professional, but my understanding is, and it says in the hospital records, that the patient must be on a ventilator to administer this, or it can be used in rapid succession intubation, which usually means minute and a half or less. 6 minutes between the time the rocuronium was administered and the time he was intubated. Why?
Yeah.
If you're given consent, you would have everything prepared and ready, right? You would think.
Yes. And
Complying.
that's why it's called a rapid sequence intubation, because everything is ready right there. You're ready.
Didn't make sense. But I didn't know this until I got the medical records. I was never told. None of it. On the 16th of October in 2021, it looks like somebody wasn't paying attention to his sedation level, because he went from about a BIS of, 50 to an 87. And the only note I can find from that time period is a nurse's note saying patient had to be bagged via BVM for 30 to 40 minutes. Now, he's supposed to have been on a ventilator for 4 days. Why is he being bagged by a BVM for 30
That's
to
a
40 minutes?
bag, guys. That's somebody actually squeezing a bag
And a mask.
to give breaths. Yeah.
BVM, you can't use a mask when somebody's intubated. You connect it to the tube, right? So, but he was bagged via BVM, bag valve mask, specifically, which means he wasn't intubated at the time. So it appears what happened, in my interpretation of the medical records, based on a lot of different factors and context, that he extubated himself. He woke up and he extubated himself, and he had to be reintubated. Now, I understand this happens. This happens in ICU. My mother did it when she was in respiratory failure. I know it happens, but it was never documented. No intubation, no second intubation was ever documented. However, between the BVM note and the fact that they have to X-ray, do another X-ray to verify the placement.
Yeah.
It's in a different location now. All of the measurements have changed. They're no longer measuring from his lips. Now they're measuring from his teeth. The way it's been secured has been changed. Everything is different about his ET tube and its placement, but it was never, the event was never documented, except that one nurse. That's the only nurse's note. Doctor never documented anything. And after that event supposedly happened, or supposedly didn't happen, the doctor orders verbally a RAS -5 sedation goal. Never
Unarousable.
changed. Huh?
That to you guys. So the RAS score is the level of sedation. So a 0 is they're alert and calm, right? A -5, which is the last one. It goes from -1, 2, 3, 4, 5, and 5 is unarousable, like no response to any voice or physical stimulation, like literally knocked out.
Yeah.
Which we don't keep people there. We don't want them there.
The way I understand it is that, except for very, very specific circumstances, it should never be a sedation goal. When you hit a RAS -5, that should be the time when you say, okay, we need
got to
to
back off. Yep.
It should never be a therapeutic goal unless it's a procedure or something specific, exigent circumstances kind of thing. And so he orders this RAS -5 and never documents it. The doctor never documents it anywhere. The nurse in the medication administration record, to justify now putting him, immediately restarting him back at a Precedex at 1.5 max dose per doctor's order at bedside. No titration, simply straight to 1.5.
Like
25 milligrams of midazolam titrated, 80 milligrams of propofol. This is all at the same time. This is what he ordered. 6 hours later, my husband had no brain activity. It was temporary, but once the BIS started to document again after the 0, his brain activity remained extremely erratic after that. He would jump from a 3 to a 20 to a 6 to a 75. It was like all over the place. To me, being unexperienced, it looked like someone was having a seizure or literally their brain was short circuiting. I have desperately tried to find a neurologist that would be willing to kind of give me some guidance on what that meant, but haven't had any success with that. So, but
I have a neurologist that would probably look at it for you.
but these are the things, like I said, never told anything. Never. As far as I was being told, the nursing staff and everybody was telling me on the phone, he's doing fine, he's stable, he's doing really well. We got him down to, on the ventilator, we got him down to a 40% FiO2 at, and I'm like, well, that's great. Can we try sedation vacations? Can we try breathing tests? Breathing trials. Can we try to get him off? Doctor says, nope, that's not going to happen. I'd been with my mother on a ventilator a dozen times. Most of the time, she was very lightly sedated. She was awake, almost, drowsy,
Right.
but she could respond. It didn't make sense. Nothing I understood about medicine from prior to COVID was what I was seeing and hearing now. He passed away, took his last breath on October 20th of 2021. I had to wait 11 days to get his death certificate. And the first thing I did was I went straight to that hospital and looked for that consent form, because the moment he went on that ventilator, I knew he wasn't coming home. And I knew in my heart he would rather have stopped breathing than to be tortured, literally tortured. No food, no water, no nutrition. Even while he was on the ventilator, no nutrition was provided. None.
How long was he on the ventilator for?
Less than 8 days. No, excuse me. Almost 8 days, 1 hour short of 8 days. 1342 was when he was officially intubated, according to the respiratory therapist's note. He took his last breath at 12:23 on the 20th.
Yeah.
So this is why I would never have known any of it. I got to come in and see him after he was intubated. I was the one, because they after the whole BVM and everything now, because at the time when this supposed second intubation never happened, he now has a pneumomediastinum. He has bilateral subcutaneous emphysema. Literally, he's blown up like a balloon around his neck. Wasn't there the day before, but immediately following this event that never happened, that was noted by the nurse, this has all now happened. My understanding is a pneumomediastinum generally occurs as a ventilator-induced lung injury. Can happen with severe coughing and some other things, but most commonly it's a ventilator-induced lung injury.
Yeah, we usually say the lungs blew out, right?
Not told. Never told any of it. And so, yeah, my very first thought was, for my peace of mind, it was an obsession for me to find a signed consent form, because I did not believe that would be the way he wanted to spend the last 8 days of his life.
Well, he told you he didn't want to do that. And, and that's not to say that some people don't change their mind and stuff. But again, it's the whole protocol, guys. We can pick through it and on both sides. I could do it as an ICU nurse. I can see it from the patient's point of view. We don't always obtain consent right before we have to do something if it's emergent, all those things. But it was documented in his record. He was there speaking when he was admitted into the hospital.
He was at a 91% oxygen saturation the moment they administered the paralytic. He was at a 91.
Wasn't he on the BiPAP though?
Yes.
Yeah, so that's why his oxygen was up. I mean, it was still probably a little low being on the BiPAP, you know what I mean? But
yeah,
it's just the whole thing. It's the whole thing. And again, guys, it's like the stories are so similar, right? They're so similar. And you hear over and over and over again, or families or people that have talked to me or comment on my Facebook page, tens of thousands of you over the last 5 years. And they tell the same kind of story, the same sequence of events. I'll speak for my hospital because I know firsthand experience. Then we got in the high flow oxygen because we realized people do better with vapotherm than they did being intubated. But again, this is about us going from the top. okay, and saying who created these protocols, and they rained down on everybody. Who said no steroids? Who said no antibiotics? Who said all of these things? Who said put them on a ventilator? Who said all of these things? That's what we need to figure out, and that's why we need testimony so that Ron Johnson can open up an investigation.
Well, and I will say there is a purpose for, I have nothing against all doctors. I have nothing against all medicine. But my history and my experience had told me this didn't make sense. The problem was I couldn't be there to actually see the context of how all of this was
That's right.
happening. If it had been, it may have been perfectly justifiable. But if it was, why wasn't it documented? Why wasn't there any note in the doctor notes anywhere that he's having the conversation with me saying my husband has given consent, but never puts in a note, patient gave consent, never documented
Patient
it.
consented, right.
Never documented my whole conversation with him. I have my call logs that can show I was on the phone with him. I have the call logs from the video call. I have the call logs from my cell phone that show the hospital calling me, the whole 9 yards. Why wasn't that documented? But the conversation, a page and a half that the doctor sat down and wrote notes about how he didn't think he was stable enough to be transported because we tried to get him transferred to another hospital. I said, something's wrong here, right? I want him to go someplace else. All of these conversations with me he had were documented, except for the no, he won't be intubated.
Yeah.
But none of the conversations were documented that he ever spoke to my husband. Nothing. As a matter of fact, there's no nurse's notes that anybody ever spoke to my husband. There are 2 notes prior to intubation, and they're both the same day of the intubation. No notes from the day of his admission, no notes from the second day. The third day, none.
No
None.
nurses' notes at all?
None. There's none. And this is why it's so
And you
important.
didn't get the complete record.
Yeah, I got
Or did you
3,000
get the
pages for
complete?
10 days. I got flow sheets. I got
With no
medication notes.
nurses' notes.
No nurse's notes until the day he was intubated. He was admitted on the 9th. He was intubated on the 12th. The 12th is the very first day there's a nurse's note.
Wow. Well, we document on every shift.
And
And
that
we have to
nurse's note,
document.
that nurse's note specifically said patient refuses to speak with spouse. That's it. The day he was
Wow.
intubated. There was, and that's why I'm saying, if there was a perfectly good explanation for this, I am open to it. If they can explain some of these things that don't make any sense to me, I looked through those medical records looking to prove myself wrong, not to prove they did something wrong. That wasn't my purpose. I grew up with a nurse. Doctors weren't the bad guys. Doctors are the good guys. Medical professionals are the good guys. They help you when you're hurt. So I was trying to prove my insanity because I believed I was just a grieving widow and I had lost my mind because I didn't know what was going on. I was trying to prove I was wrong and that I wasn't what I was seeing, believing, and feeling hadn't really happened. Instead, what I found was more questions than answers. And if they had documented any of it, I would have been, okay, well, this makes sense. But ordering a RAS -5 and not changing the order for the medication and instead erasing all of the administration instructions, the dosing instructions, not replacing it with an appropriate order, and I understand COVID things were kind of hard to keep track of maybe. But when I did get to go in and visit, and I'm not going to say this is, like I said, this is not all medical professionals, but on that unit, I was the one who had to call the code on my husband when he took his last breath. The nurses were down the hall hanging out at the nursing station with their feet on the desk. And they told me because he had ended up in this rotoprone bed after the event on the 16th, that it was going to take him about 10 minutes to get him out and try to, start performing resuscitative efforts. So it was better if I just signed a DNR. And I said, no, I will not sign a DNR. You will make every effort to resuscitate him. And as I'm there and I'm watching his, all of his vitals start to just kind of, that they're ticking down.
Yeah.
We're satting a little less, blood pressure's dropping, heart rate's dropping a little bit. They start modeling, start getting a little gray at the feet, starts working its way up. I'm watching this and I go out the door and I said, I need somebody here now. I said, what's going on? I said, he's fixing a code and you told me it was going to take 10 minutes to get him out of this bed. I need you here now. We'll be there in a minute. A couple minutes later, the alarms start going off. And of course, then they came rushing in. I'm like, I told you there wasn't any bringing him back at that point. And honestly, after what I realized he had suffered through And after the zero brain activity and the irregular, erratic BIS monitor, all of this stuff, the damage that had been done to the organs, it was the grace of God that gave him respite that day. I wanted to save him, but he wouldn't want to have lived the way he would have come out of that hospital if he had survived. He wouldn't have been himself. He wouldn't have been the man he went in. And as hard as it is for me to say that, because I miss him every day, at least the torture was, not the torture, at least the suffering had ended. He put up a valiant fight. He really did. And as I said, if there's anybody that could explain it to me to make it make sense in context, that could justify the things that happened and explain why they happened, I'd be overwhelmed to hear it, because then I'd know in my heart, beyond a shadow of a doubt, that they did everything they could to save him and to help him and to bring him home.
Yeah.
I want that. I don't want to believe that I have to be afraid to ever take my son to an emergency room, that I have to be afraid myself to ever go to an emergency room, because I don't know what I'm going to get when I get there. Am I going to get a nurse or a doctor who is ethical and will give me, and I've been to hospitals with other people since, and I've seen amazing treatment. It didn't seem to happen anywhere but in the COVID ICU. It seemed, even at the ER when I took him there, he was getting appropriate treatment. He was doing well. He was doing fine. He was getting the breathing treatments. They started him on steroids. They checked, did all the blood work they needed to be done, checked for bacterial infections. They did everything they needed to do in the ER. But the minute they made that phone call for him to go to the ICU, everything changed. Once he went behind those locked doors, everything changed. And all I know is what limited information and education I have to be able to interpret it. I'm sorry. I apologize.
No, I wanted you to explain and to have your moment, because I know that so many people will relate to it, Leslie. Me being a nurse, I remember having a conversation. I actually recorded this conversation, and I haven't released it yet. There's a lot that I haven't released. I don't know what God wants me to do with it, but I have it. And it's a nurse and a doctor asking me, Jodi, I know you don't believe in masks and you don't believe in the shot. Do you think if you came down with COVID that we should have to treat you? And I was like, we take care of child murderers, rapists. Are you seriously asking me that question? And some time went by, maybe, I don't know, it's such a blur. I'd have to look at my timestamps on my videos. But that nurse actually came up to my office when I was house supervisor one night, and we talked. And he was like, I'm sorry I even said that. And I said, this is the problem. Nobody understands what they're saying. They're saying this crazy, crazy stuff, and they're thinking it's normal. And it's not normal. And it's evil. How do I know it's evil? Because it's guided by fear. You're reacting to me because you're so fearful. Who is the author of fear and confusion? Satan. That's who you're listening to. That's who you're listening to. I'm trying to stay of a sound mind and body over here. And that's why you see me trying to have conversations with everybody. Documented in my court case of multiple doctors and witnesses that says, this shouldn't surprise no one what Jodi did. She has been talking about it for 18 months. But what I didn't know, Leslie, is that was called whistleblowing. I didn't know the term. I was blowing the whistle. I was talking to everybody, supervisors, and in my charge notes, in my house reports. I was blowing the whistle and I didn't even know it. So, guys,
there had been many, many, many more of you.
And you know what? These are the ones that I want to reach out to, because there were so many of us that did these things, and maybe not, pull out their cell phone, give it to James O'Keefe and release it virally to the world. But there was many people that did. We know it's our clinical training. It's our gut instincts that we get. It's God talking to us. That's what I'm saying. When nurses hear this, doctors hear this, and I'm saying there's an opportunity here, guys, for them to investigate what happened. It's kind of similar to a VAERS report. We're not saying that ultimately that they murdered people in the hospitals, but we have safety signals that say that they did. So we need somebody to take all of this data, which that's your reports, and an investigation to be open. Other than that, I have very little hope for any accountability or justice for those that, like the Faucis of this world, that, allowed this kind of stuff to happen and repeat this propaganda, that people became fearful and they were scared. And then they said, and by the way, if you don't take this shot, you're going to lose your paycheck. You may even lose your license if you talk about it at the nurse's station, doctor's station. We are going to report you to the board.
Somebody asked me what accountability looked like for me. In the beginning, when I was very angry, I would have said prison if they deserve it. I'm a firm believer in the rule of law and process and going through all of the necessary motions. If they were found guilty, prison would have been accountability. Something has changed in me because even if there were crimes committed, punishing somebody wouldn't bring my husband back. I can't bring him back. What's more important to me now is we don't ever do this again. And so accountability for me, I want acknowledgement, admit what was done publicly, openly, admit what happened, accept it, because if we can't accept what happened then, we can never prevent it from happening again. And this is going to sound crazy, but apologize. I cannot forgive until somebody asks to be forgiven. I want to so bad. And I know as a Christian, it's my responsibility and I want to, but how do I forgive somebody that continues to make excuses for their behavior? So for me personally, accountability is basically repentance. So you know what? I made a mistake and I'm sorry I made a mistake. I won't do it again. And I will do what I need to do to make sure that I protect people and I don't let somebody else do it again. And that to me is the ultimate accountability because that makes us all safer. Doctors and nurses are the patient's advocate. They're the ones who stand in the gap. And do I think Fauci's a great guy? Absolutely not. No. I have no love lost for Anthony Fauci for the things that he's done. But for me, the last hope, the last advocate, the last barrier to protect a patient is the nurse and the doctor. And I understand that medical professionals at every level were put in very, very difficult situations. And it was very easy when you're hearing, late night hosts saying, well, you didn't get the shot. Good luck, Wheezy.
Yeah.
You don't deserve to be treated. You don't deserve a hospital bed. Guy having a heart attack, come on in. And we were treated like a pestilence. Anyone who was unvaccinated was a scourge of humanity because we didn't care enough about our fellow man to protect ourselves and them. And that wasn't the case. I assure you that wasn't the case. We cared a lot.
Yeah.
Because we didn't want the vaccine to harm. And I've never blamed anybody for getting the vaccine. That was their choice. They have the right to make that choice. I don't think it was ever appropriate for them to be forced to take it, but they have the right to make a medical choice that they see fit, risk, versus reward, benefit analysis kind of thing. That's their prerogative. Let me make mine. Let me make the same choice. That's all I ask. You do you, boo, kind of thing.
Right.
So it's a hard place to be because I still want to see justice served. But justice doesn't look now like what it looked like then.
Yeah. I'm 100% agree with you. When the judge asked me at the end of the hearing, what do you hope to get out of this? I said, what do I hope to get out of this? I want people to know what happened. I want people to understand what happened to their loved one behind those closed doors where they weren't allowed to be in. And I want the doctors and nurses to understand what role they played into it so that this never, ever happens again. And then I went on to get my long-term continuing education provider training, and I teach that to nurses now, the ethics,
God bless you.
the code that they never knew. You ask any nurse, Leslie, do you know what the nursing code of ethics is? And they're like, yeah, what is it? Do no harm? What else? Honestly, I don't know. No, you don't know. And it's not your fault you don't know, because the only reason I know it is because I had 18 complaints that came against it. That's why I know it. I knew it before I blew the whistle. That's why I blew the whistle, because I was like, oh, this supports me doing it. This supports me doing it. Ever felt torn between your conscience and your job? You're not alone. It's time for nurses to rise, to lead with integrity, grit, and faith. Earn CEUs that teach you how to stand firm in truth and advocate without fear at righteousrn.com. That's righteousrn.com. Protect your license, your integrity, and your peace. So that's where my passion is. That's why I have Nurses Out Loud. That's why I'm doing what I'm doing. But Leslie, thank you so much. Thank you for accepting all of these emails. Guys, we're going to give her thousands of them, right? We are going to just flood her with these emails and your stories. And if you need any help, comment on whatever you're watching this at. And send me an email. You know, if you want to keep it more private, I will absolutely help you, give you the guidance. But what my goal is on my Substack page is to give you a prompt that you will literally just vomit your story to a voice recorder. Talk to it for 30 minutes if you want to. I don't care. But that prompt is going to take what we need and put it into 600 words or less. And it's still not going to feel enough. But this is what we need. We need you to follow the rules so that this can actually get done. And I'm going to close with another little message to those that are listening as well. I know there's so many different groups out there, so many different groups that have really passionately tried to advocate and help, and they have spent enormous amounts of time, thousands and thousands of hours of volunteer work and not get any accolades or payment for it. And God bless you. Thank you. But as this moves forward and this gets publicized the way that I am praying God to publicize this so that we get those thousands of, we only need a couple hundred, but I want thousands because I know there's so many of you, is that we need to not fight against each other. Not say my story. I'm my story. You don't know how many hours I've worked, how much I've suffered, how much family time I missed, how much blah, blah, blah. We all have done it. We all have done it. Maybe some have done it more than others, but at the end of the day, check your ego. Check your ego, search your heart, and realize that if this does get in front of Senator Johnson, if we get enough testimonies and he has this hearing, that everybody, all of your fight, all of your talking to people and telling your story and everything, this all matters and it's there. But please do not think that your story is more important than the other. That's what I ask. I ask that we don't fight with one another. There's many people that I'm not involved with anymore, that you don't see me with anymore, but you don't hear me talking about it. If I see them or they're putting something out, I share their post still. Because it's about the mission. It's not about what I feel about them personally. You get what I'm saying?
I really don't have any animosity towards the healthcare profession as a whole. I just want them to do what they do best. Love their patients and heal people.
Yeah. And I want you to follow your code of ethics. Read the book. Go to righteousrn.com. I have free resources. I have courses. I have 11 different modules that I did. I created the course Navigating Ethical Waters, a comprehensive approach to nursing ethics post 2020. And I take all these courageous nurses and stories and I use them as real life case studies, not just an actor. It's their real story. And we're just going to keep sharing it, guys. So until next time, friends. Be safe, be well, and God bless. Thank you for listening to Nurses Out Loud. Nurses are called by our code of ethics to keep learning, do the research, and lead with moral courage and integrity, especially as healthcare changes. Keep doing the next right thing, especially when it's hard. If this show resonated with you, please like, share, and follow. It boosts us up in the algorithm so more people can find us. Until next time, friends, be safe, be well, and God bless. And if this episode offers continuing education credit, check the show notes for the learning objectives, disclosures, and exactly how to earn your certificate.